10 things the fully vaccinated need to know. Here's what you should and shouldn't do post-vaccination according to health experts. If it has been at least 2 weeks since you've received your last dose of the COVID-19 vaccine, congratulations. You are now considered fully vaccinated. You are armed with our best weapon against a virus that has killed more than 2.6 million people worldwide and upended our lives in unimaginable ways. Being vaccinated is truly something worth celebrating. But before you toss aside your mask and throw a party, it's important to remember that the coronavirus is still spreading and the majority of Americans have yet to be vaccinated. So precautions continue to be necessary to protect yourself and the people around you. The U.S. Centers for Disease Control and Prevention, otherwise known as the CDC, has published some guidance about what the fully vaccinated can and cannot do. And experts have answered other common questions about life after vaccination. Here are 10 things you should know now that you've been jabbed. Number 1. You still need to wear a mask. Even though COVID-19 cases are down from their peak in January, the coronavirus is still circulating in the US and new and more contagious variants have emerged. So wearing masks and social distancing are still important in helping slow its spread until we can reach herd immunity, when an estimated 70 to 85% of the population is vaccinated. Until more of the population is vaccinated, masking is important, not just to protect yourself, but also other people. Masking will also help slow the spread of the coronavirus variants and prevent the emergence of new ones, because the virus can't mutate if it's not spreading. Number 2. You could still catch COVID-19. This is the other reason experts don't want you to put aside your mask just yet. Although all 3 vaccines authorized for emergency use in the US were found to be highly effective against severe disease and death from COVID-19, there's still a chance you could get infected with the virus. The Pfizer and Moderna COVID-19 vaccines were about 95% effective in preventing symptomatic COVID-19 after 2 doses in clinical trials. The Johnson & Johnson vaccine was 66.1% effective in multi-country clinical trials and 72% effective in US trials. The whole point of a vaccine is it prevents you from dying or ending up in the hospital, but you may still get sick. Number 3. You could infect someone else. There's a small chance that you could get infected with the virus and not even realize it, and then you could transmit it to someone who is not vaccinated. Researchers are still studying whether the vaccines prevent the asymptomatic spread of the virus. Early data indicates that they likely do, but the evidence is preliminary and more research is needed. Number 4. You can visit friends and family. Fully vaccinated people can gather indoors with others who are also fully vaccinated without wearing masks or physical distancing if you choose, because the chance of anyone getting infected would be remote. You can also spend time inside with unvaccinated people from a single household without wearing masks or physical distancing, as long as no one has an increased risk for severe COVID-19, nor do they live with somebody who has an increased risk. That means you can visit and hug your unvaccinated children and grandchildren. What's important, the CDC says, is to keep 2 unvaccinated households from mingling. The agency offers this example. If fully vaccinated grandparents are visiting their unvaccinated daughter and her children, and the daughter's unvaccinated neighbors also come over, the visit should then take place outdoors with everyone wearing well-fitted masks and maintaining a physical distance of at least 6 feet. This is due to the risk that the 2 unvaccinated households pose to one another. The CDC still recommends avoiding medium-sized and large gatherings. Number 5. You don't have to quarantine after exposure. You do not have to quarantine or get tested after an exposure to someone with the coronavirus as long as you aren't experiencing any symptoms. However, if you develop a cough, fever, shortness of breath, diarrhea, or other symptoms of COVID-19, you should get tested. Number 6. You should keep your vaccine record card handy. In the future, you may need to show proof of vaccination to travel, work in certain industries, or attend large events. Several other countries already have a validation system in the works, and a number of private companies in the US are working on creating a digital passport that would include your vaccination status. Obviously, your vaccine card is your main proof right now. Your card may also come in handy to confirm which vaccine you received and when you received it if a booster dose is required. Some people are laminating their cards. Another way to preserve it is to take a photo and store it on your phone. If you didn't hang on to your card, the provider that administered your vaccine should have an electronic or paper record of it. Number 7. Travel is still discouraged. Even though the number of airline passengers has been rising, the CDC continues to recommend against travel, even for those who are vaccinated. In terms of travel, here's what we know. Every time that there is a surge in travel, we have a surge in cases in this country. We know that many of our variants have emerged from international places, and we know that the travel corridor is a place where people are mixing a lot. The CDC is really trying to restrain travel at this current period of time, and are hopeful that the next set of guidelines will have more science around what vaccinated people can do, perhaps travel being among them. Number 8. It's a good time to go to the doctor or dentist. Countless Americans put their healthcare on hold due to the pandemic. Now that you're vaccinated, it's time to schedule that colonoscopy, dental cleaning, or elective surgery you've been putting off. Being vaccinated now is the safest it has been to have surgery in well over a year. The only screening you may want to hold off on getting right away is your mammogram. According to the CDC, many women develop swelling lymph nodes in their underarm after vaccination. Although the swelling is a normal sign that your body is building protection to the coronavirus, it could cause a false mammogram reading. For that reason, some experts recommend waiting 4 to 6 weeks after you are fully vaccinated to get a mammogram. Number 9. You may need a booster shot. There are 2 reasons we might need a booster shot: if our immunity wears off naturally, or if the virus changes so much that the immunity we have from the current vaccines proves inadequate. Researchers still don't know how long immunity from the vaccines will last, as data is still being collected. The current vaccine should provide some protection against the coronavirus variants circulating right now. But a few contain a mutation that may allow the virus to elude some of the antibodies produced through vaccines. The vaccine manufacturers are working to create booster shots or updated versions of their shots to improve protection against those variants. Chances are that we will have to get some kind of COVID-19 shot on a regular basis. Perhaps once every 3 years or every year like the flu shot. And finally, number 10. A return to normal hinges on herd immunity. Before life can get totally back to normal, experts say that first we need to reach herd immunity, which is when enough Americans are vaccinated to significantly slow the spread of the virus. Estimates of when we will reach that point range from this summer to early 2022. Factors that will affect that timeline include the percentage of Americans willing to get the vaccine, how quickly a vaccine for children is authorized, and how well the vaccines work against more contagious variants of the virus. This presentation was adapted from an AARP article, 10 Things the Fully Vaccinated Need to Know. Here's what you should and shouldn't do post-vaccination according to health experts, written by Michelle Crouch. The article can be found in the link provided or on the AARP website. Thank you for watching.